everyone. This is Joyce Davis, the President and CEO of the World Affairs Council of Harrisburg, and some of you also know me as Penn Live's Outreach and Opinion Editor. I try to do both jobs, and it can be difficult sometimes, but thank you for joining us tonight for what we know will be an important discussion. Tonight, we're going to talk about COVID-19 and faith communities. And to begin our discussion, we also will have just an overview from Dr. Denise Johnson. We are so delighted to have this group of people here. And I have to share with you that the reason we're doing this and that the reason we've put this as a co-sponsor, the Bethlehem Baptist Church of York, is because they reached out to us. Jerisha Gilbert heard one of our previous webinars with COVID and said, could you help us as we attempt to educate our community and to deal with vaccine hesitancy? So we said yes, and here we are. So with that, I'm going to now turn it over to Russell Goodman, Pastor Russell Goodman, who will be your moderator for tonight. Russell?
Thank you, Joyce, and good evening to everyone. Welcome to what I think is going to be an interesting and, as Joyce said, an important program. Important because COVID is not a respecter of any faith. It's something that affects all of us, has affected each one of us. So I think tonight's conversation, COVID and our faith communities, will be an important one. Our lineup of speakers this evening includes spiritual leaders and representatives from a number of faiths. Now, clearly not all of the faiths that we see throughout the Commonwealth, but quite a few. And I am delighted to say, as Joyce mentioned, our speakers tonight include the Commonwealth's Physician General, Dr. Denise Johnson. You know, in discussing the pandemic's impact on faith communities, tonight we're going to touch on such topics as how faith leaders have managed the divisions in their congregations over such things as vaccination, masking, social distancing. I think we all know there's been some difficulty in faith communities, a lot of divergence of opinion there. Is there still significant resistance to vaccines? And we're also curious about what faith leaders have found that worked or didn't work, that failed in their efforts to guide their congregations and communities. And I suppose our faith leaders tonight are going to have some questions for Dr. Johnson. They want to ask medical authorities, how can we prepare for the spring, for the summer months that are coming? And we say COVID is over yet? People are beginning to emerge. We're often back in our houses of worship. Is something new on the way? All right. Our speakers this evening include Reverend Dr. Paula Morrow, Superintendent of the Williamsport District of the United Methodist Church's Susquehanna Conference, Mia Malik, representing the Sunni Muslim community of Central Pennsylvania. I'm going to hear tonight from the Reverend Sandy Strauss, Director of Advocacy and Ecumenical Outreach of the Pennsylvania Council of Churches. The Reverend Dan Caldwell is with us tonight. He is a chaplain with Homeland Center, and in his capacity as chaplain, he works with many persons in hospice care. Bezod Zandier, representing the Baha'i community of Central Pennsylvania. From Congregation Hisek Emunah in Harrisburg, Rabbi Ron Miroff is with us tonight. Dr. Madhu Parikh, representing the Hindu American Religious Institute here in the Harrisburg area, is with us tonight. I'm also glad to see that we have from Bethlehem Baptist Church in York, Nicole Moore. Our discussion will begin with Dr. Denise Johnson, our Physician General, but first, I'm going to ask the Reverend Aaron Wilford Jr., pastor of Bethlehem Baptist Church in York, if he will lead us in an opening prayer. Reverend Wilford, the floor is yours.
Gracious and eternal God, we thank you for tonight's gathering. We thank you, God, for the hearts and minds of your people who look out for the well-being of all of your people. We pray that you would bless all that we do, whatever questions that we may have tonight, that those answers may be found, that we might encourage the hearts of your people, remove any stigma, any frustrations, any concerns that they might have, that the vaccine can be given and that healing can take place. Thank you. Amen and amen.
Amen. Thank you, sir. Thank you very, very much. And now for an update on the virus and our efforts throughout the Commonwealth to combat it. I'd like to welcome the Physician General of Pennsylvania, Dr. Denise Johnson. Dr. Johnson, the virtual floor is yours, ma'am.
Thank you very much. Can you all hear me okay?
Yes.
I've learned that from 2 years on Zoom that I need to check before I get started.
Mhm.
So it's my pleasure to join you tonight. And I am so honored to be surrounded by all of you faith leaders. This has been a really difficult time for all of us and for, I know, all of your congregations. And we've really needed to lean on our faith during this time. We've had so much uncertainty, so much upheaval, so much distress, and knowing that we still have communities of faith that will help us to get through this has really been important during this pandemic. So thank you all, each and every one of you, for all that you have been doing for all of us during this pandemic and before and going forward. So thank you for that. I think we're all excited to see and relieved to see that COVID-19 cases, hospitalizations, and finally deaths within the Commonwealth are starting to go down. So that's really, really great news. But I know that it's still going to take some time for people and for businesses and for communities and faith communities to really recover from the lingering effects of what we've had over these past 2 years. And I'm looking forward to this discussion tonight. But first, I want to remind everyone that COVID-19 is not gone, but there are clear things that each individual can do to help to protect themselves and their loved ones. So, of course, first of all, get vaccinated. We know there have been hundreds and millions of doses of vaccines given, and we know, especially with this last surge of infections that we've had, is that the vaccines are really good at preventing severe illness, hospitalization, and death. Next thing to do is to get a booster. If you are eligible for a booster, if that time has come, please get a booster because it really substantially increases your level of protection. Still, there are times that you should wear a mask. You should wear a mask if you've got underlying conditions that make it risky for you to be out in big crowds. You may want to protect yourself. Or if you're going to be in crowds where there may be vulnerable people, it's still a good idea to wear a mask. Or if there's a lot of spread in your area, there are times that you still want to consider wearing a mask. And then get tested. If you're exposed or you have symptoms, gone are the days when we power through when we've got a fever or we've got symptoms. You really need to test yourself and make sure that you're not infectious. And then there are treatments available. So if you do test positive, find out if you are a candidate for treatment and seek that out as quickly as you can. So as an overview, because the COVID numbers are fluctuating up and down, we're really looking at trends instead of those daily numbers that we were looking at before. So we're looking more on the monthly trends. And so that's a good progression from where we've been. So the statewide COVID-19 cases that we've seen over, say, the month of February was probably around a little over 1,500 cases a day. But we are trending down now, and I would think that in the month of March, we probably will average less than 1,000 cases a day. So that's great news. From even last week, we have 27% less people in the hospital, and we've gone below that 1,000 people in the hospital number, although we had been up much higher than that. more than 77% of our adults are fully vaccinated. And every day we're still giving thousands of vaccines, and that includes booster doses and pediatric doses as well. And so that's what I'm here for tonight, to answer questions that you may have, and also to hear about how our communities of faith have been faring during the pandemic. So thank you very much.
Thank you, Dr. Johnson. Thank you very much for that. Let me just piggyback on something that you just mentioned. Deaths are indeed going down, which is great news, because let me tell you, the faith leaders here, I know they are saying, as I've heard pastor after pastor say it, I am so tired. I have done one funeral after another throughout this COVID situation. It has worn me down, and I'm sure many people here can speak to that tonight. If the numbers are going in the right direction and so many persons in the Commonwealth are vaccinated, why should we do anything now? As spring happens, which will begin on Sunday, really, do we need to do anything else? Right now, people are coming back to houses of worship. They're not wearing their masks. Do they really need to do that sort of thing?
Well, again, the cases are going down. So we're seeing a lot less spread of the virus. And we are starting to see less people hospitalized and less people really sick. But there are still people who are vulnerable. And, even now, we're still seeing deaths on a daily basis. And so that people who are not vaccinated we still have unvaccinated people, they really still can get very, very ill with COVID, and we still can see deaths. So, until we're 100% vaccinated, we're going to keep working to get people vaccinated. And we want to make sure that everyone's up to date with their vaccines as well. And then remember that there's some people who are immunocompromised. And so even if they get vaccinated, they don't mount a good immune response. We do have some treatments that can help to prevent, but none of that's going to be 100%. We always will have vulnerable people in our communities.
Mm-hmm. You talk about the vulnerable people that you want to protect. So maybe you want to be wearing a mask. That does remind me that somebody once said to love one's neighbor. And maybe you do that sort of thing if you're taking precautions. I want to turn to Reverend Dr. Paul Amara. Paul, you are up in Williamsport. You are the superintendent of some 130 churches. So that means that you have to have heard stories from any number of pastors about what it's been like to try to manage the divisions in their congregations, those who want to take the precautions, those who are very much against it. What have you been hearing? I think you need to unmute there.
Sorry,
Thank you, sir.
one thing that we always forget. Yeah, I was just saying thank you for inviting me to this forum, and it's a blessing for me to be here and to be amongst religious leaders and medical leaders. First, the impact of COVID-19 pandemic on faith communities has been really great. I will just outline some of the impacts that we have had. One will be fear. When COVID hit, there was great fear amongst parishioners who were actually confused and even helpless, as there were no direct remedies to control the situation. So people did not know what to do. This was very new. And there was also despair because parishioners were hopeless. They did not know where to go. The loss of family connections, physical connections were lost. So people were confused, and that had psychological effects on church people and even the church leaders like pastors. Remember, this happened 2 years ago, and it was on Easter time. I remember the first time it was March 8th in 2019, when most churches in our denomination, in our conference, Susquehanna Annual Conference of the United Methodist Church, were closed. And people did not know. For so many people, that was the first time in their lives that they could not go to church physically on Easter Sunday. So that brought a lot of issues in people's lives, including like life adjustments. People had to adjust their life because gatherings, visitations, shoppings, and a lot of things changed. Everyone was afraid and nobody really wanted to go out there because you did not know who had and or who did not have. Also, ministry came to a halt because in ministry is not about the building. It is about being out there. So how could you do effective ministries if you are not actually going out into the field? And like Jesus said, the harvest is ripe, but we need those harvesters to go out there. We need people to go out there. And people were afraid, they were scared. So, and
Well,
not only that.
Clearly, it was a burden then on the faith leader to be able to deal with those fears that the parishioners were feeling. Let me ask you, Reverend Wilfred, down in York, did you see something similar to that at your church and throughout the other churches that you are familiar with in that area?
Yes, we did. As a matter of fact, I serve on board for the Pennsylvania Baptist Convention, and all across the state, a number of churches were shut down for almost a period of 1.5 to 2 years. And sporadically, they would go back into their buildings for a period of time. As Pastor Mara said, it was and still is somewhat challenging to do ministry. We tried to, to as many, I'm sure, do Zoom, telephone calls and what have you, but that works for a period of time, but it does not generate, if you will, the kind of peace that our memberships receive by being in worship. And
what kind of, let me ask you this, what kinds of divisions did you see or witness among the congregation themselves? The people who said, yes, we want to take these precautions, others who said, no, we're not going to do it. It's a matter of my personal liberty. Did you see that, and how did you manage that?
I guess I was somewhat, as Sister Nicole would tell you, I'm a little bit more fortunate perhaps than some of the other pastors. I've been pastoring the church for 43 years now. So they said, Pastor, we trust your judgment. So I have not had the wrestling match that many other faith leaders have had. And so, I share with my congregation, the pros and cons. I myself had a battle with COVID November over a year ago, which kind of affected my kidneys, which caused me to have open heart surgery. And now I am, I have an LVAD. I just celebrated my first year with this LVAD. And so it's been challenging, but mine has been somewhat different.
Well, your
than a lot of faith leaders.
Your personal testimony would be very persuasive when it comes to telling people you need to take precautions. Rabbi Miroff, I know you have been at Hisuk Ramuna for going on 30 years or so, I believe. So maybe people there listen to you as well. I don't know. Tell me.
No, I think among Jews we say if you have 2 Jews, you have 3 opinions, and I don't know if that's unique to Jews, but no. Okay.
So did you witness these same kinds of divisions and arguments among people, and how did you deal with that?
Thank you so much. I too would just want to add my voice to others who have already said this, but I just think we can't take for granted. You look around the screen today, men and women, people of different races, different religions. As you said at the beginning, Reverend Goodman, this is not something that's limited to one group of people or another group of people, and we're all here to learn together. I will just say it very bluntly, we have lost members due to our policies. We've taken a very cautious approach that we feel is informed by the best scientific knowledge. And some people have felt that we've been overly cautious. They've quit the synagogue because they feel, maybe to use your word, Reverend Goodman, that their liberty is being compromised. What I've tried to do is maintain relationships, though. I think sometimes when we're living in such a polarized time, we tend to see the people on the other side as other, and we kind of separate from each other and lose sight of our shared humanity. Many faiths believe that each of us is created in God's image, whatever that might mean to each of us. And so to just maintain a relationship that anti-vaxxer is not, not a bad person, not evil. They have certain point of view. In my understanding, their point of view might actually endanger themselves and might actually endanger others. But even that, I wouldn't say makes them, inherently evil or bad. And I think sometimes, and conversely, I would say to those who do have such caution about vaccination, that they shouldn't see those of us that are promoting vaccination as motivated by anything other than our sincere desire to care for each other, care for ourselves, and care for each other.
Dr. Parikh, you're with the Hindu American Religious Institute in the Harrisburg area. I have been in your temple there. Beautiful, beautiful place. And let me just say, Samir Malik, you are with the Sunni Muslim community in the area, and I have been in that beautiful mosque down there in the Stilton area. And I guess the question to each of you is that when you look at your particular faith communities, did you go through the same kind of issues when it came to saying, you must mask, we urge you to vaccinate, social distancing is something that we need to do? Or the experiences that we've been hearing from Dr. Amara, from Reverend Wilfred, from Rabbi Muroff, are these things ringing a bell with you? Is this something that you've experienced as well, Dr. Parikh?
Yes. Yeah, so during this pandemic, 2 years, it was really tough to make the devotees explain the different CDC guidelines of following all these 3 actions, that is vaccinations, masking, and social distancing. So we were fortunate that most of the devotees, Hindu devotees we have from the Hari Temple, they are, as of now, if you take the percentage, I really don't know how much the percentage, but it is very high. Most of them are vaccinated, all 2 doses, and also boosters. So the Hindu community is really very fortunate. But during the peak time, we did take all the precautions, like we put those stickers, 6 feet stickers in the temple, and limited number of people were going. The time was limited there. We were not opening it like from morning 8 to evening 8, night 8. So we limited the timings. And I think as a security basis also, I think the devotees also decreased in number. Drastically they decreased because they were all cautious about themselves. So for that, we tried to do all the different webinars, all the activities, religious activities of the temple. They were all being broadcasted from the temple via YouTube or Facebook. So, that really worked, and that really elevated our moods that we are not cut off from the temple. We are still a part of it. So the priests would be there in the real peak time, and they would be doing all the religious functions and all that. So I think we really managed it, and also social distancing we tried to do, and vaccinations, and also masking. We did put the signs everywhere, the sanitizers at multiple points. So people were really following it, and we didn't have much resistance among the people. Those who were coming, they knew and we were always putting in our Hari Temple flyers in the emails that these are the guidelines. If you're coming to the temple, follow these 3 guidelines. So I think they were all following it, and we were lucky enough that we didn't have people say, oh, why do you have to wear a mask? Even now the temple is open. And as Dr. Johnson has said that vulnerable people, the aged people, I still see that many of them are wearing masks. And they separately, they maintain the social distance. That's really a good part, because as she said, it's not gone yet. It is still, I mean, things are coming up again. So we have to be cautious. And I thank the entire committee, our management committee of the temple. Everything was really displayed in the temple, and also in the temple, in the emails. These are the things which you have to follow. And I think we were successful in that. And I don't know what's the percentage of people, as I said, vaccinated from the Hindus, but it is very high. And also the number of people infected, as I know, maybe handful of them. So, I mean, I don't know how much, what is the real number. I may not be able to know because of HIPAA policy, but definitely it is not that, because all my friend circle, family, everything, by God's grace, things are doing better. So.
I'm delighted to hear that so many persons in the Hindu community are still masking. I will tell you, as I move around various churches in the city, I'm seeing many, many, many people have decided I don't need to do this mask thing anymore. Samia, what's been the experience in the Muslim community as far as you can see?
Yeah, it was difficult, and social distancing was difficult, not a problem. Masking is not a problem. Vaccination in the beginning was a struggle because, you know, a large part of our community is African American, and because of the historical context, Tuskegee experiment, and all of those issues, we did take a lot of efforts to convince them. We brought in an imam, and his wife happened to be a nurse practitioner who came and had several talks, several masjids. The number increased in the African American community to take vaccinations then. And a lot of the other, like the Arab community and all, they had issues about, oh, are we going to bear children later on? So again, we had to bring Arabic speaking imams and doctors to explain to them health-wise what pros and cons, and that it does not affect your birth rate or what have you. And some of them wanted to do just home remedies. And again, we had to bring in, you know, people that speak their language to convince them. But by the grace of God, they all went up. I would say there's still a very small amount of people left that are still hesitant to take the vaccination. But social distancing and masking, and when they do not take the vaccination, they are very proper about not coming into the messages. So I'm happy about that.
Reverend Sandy Sprouse, quite aside from whatever you may have experienced at your own personal church, through your work with the Pennsylvania Council of Churches, are you hearing these stories throughout the Commonwealth? Is this something that is in fact a common situation? Reluctance to go along with these precautions, divisions in houses of worship, and the difficulty that causes spiritual leaders?
I think the stories are pretty much the same across the board for us. It varies, you know, by congregation and by, you know, areas throughout the state. Everyone's a little bit different. I can tell you that from our perspective, what we tried to do to help congregations to cope with this was very early on just to be a provider of information, to try to educate congregations as much as possible as we knew things. And so that was our first, you know, and providing best practices that we were finding from all over the country, from various organizations that deal with churches and so on. So that was it. We certainly did preach the gospel of wearing masks, and that wearing masks it certainly protects you, but we tried to say to people, wearing a mask is an act of love. You're doing this for your neighbor. You're not just doing it for yourself. And so trying to help people to be cognizant that some of their neighbors may be much more vulnerable than they are. Congregations really varied as to how long they closed down. Most of our congregations, as far as I know, actually did function remotely. for quite a long time. Some were still functioning remotely, even as recently as the end of last year. I'm not sure where they are now, but I think Omicron didn't help for anyone who was thinking about opening up again. Once we got to vaccines, we were certainly encouraging people to get vaccinated and helping them to understand that these vaccines are safe. They're not experimental. Well, okay, so there was a sense among a number of people that, you know, we are just experimenting with these. No, we didn't start from scratch on the vaccines, and helping people to understand that, you know, it was not just a dead rush to this to get it out there. It was, people understood what they were doing with them. So, you know, pushing for vaccines. And last summer, actually, and there's some people on this call who participated in this effort, we actually put together a series of videos encouraging people to get vaccinated. We have posted them on, we have them on a YouTube channel. I distributed them through social media. I have heard very little. Now we're dealing with denominations that typically at the national level, the denominations have been very much involved in making recommendations to their congregations. So we don't get the same kind of pushback that some folks may get. But we certainly have pushed pretty hard to tell our
To get
folks
that
they need to
message
get
out there.
vaccinated.
Mhm.
And we continue to try to provide as much information as we can.
Reverend Dan Colwell, your situation is somewhat different. You are, of course, an ordained Methodist minister, but you are working in the at Homeland Center. You are providing care for persons working there, and of course, you're very much involved in hospice care. It's a different situation from being in a church, although obviously you are providing pastoral services. I guess the question is then, what has your experience been through these last couple of years there?
Well, my experience is somewhat different as a chaplain, and I work for Homeland Center, our parent organization, and Homeland Hospice, which has a reach over 12, 13, 14 counties in central Pennsylvania. So for 2 years, I, in essence, haven't changed a thing except what I wear on my face. In other words, I've traveled over multiple counties to facilities, healthcare institutions, and private homes to provide individualized hospice patient care through Homeland. And then I've also provided general chaplaincy support to the residents at Homeland Center and our hospice patients who live there at the center. So I've had a broad reach. I've traveled far and wide, and none of that has really changed. As I said, all that changes is what I need to wear with me in a particular home or in a particular facility. And in my case, it's really just this, adapting pastoral ministry to whatever setting I find myself in. If I'm in a facility or a particular unit on a facility, then I wear the appropriate PPE, the appropriate protection. One morning, I might have a surgical mask on in one facility. In the afternoon, I might have full PPE covering me.
You're still
head to
doing
foot in another facility. At Homeland Center as well, I have adapted to whatever the protocols are on each unit or in the facility. In terms of leading worship and providing pastoral care, I've simply adapted month by month and cycle by cycle. I've done worship services in the hallways. I've traveled from room to room and doorway and threshold to threshold. It changes or has changed by the week and the month at times. Sometimes services are in the chapel. Sometimes they're in private dining rooms in a particular living unit. I simply adapt to whatever the circumstances warrant. But pastoral care, spiritual support, end-of-life care, leading worship. None of that has stopped. So it's been a real privilege and a blessing for me to really not change anything except the mask or the PPE that I wear on a particular day.
You heard us mention that spiritual leaders have said that they have just been worn down by the number of funerals they've had to conduct throughout this COVID time. How has that impinged on you and your experience in your world?
I think the deepest impact has been on the level of grief or complicated grief that might arise in these COVID months as persons have had limited access to their loved ones. In other words, depending upon the time of the year or the cycles of COVID and our responses, there have been times when contact and intimacy, as we heard before, has been extremely limited. We've overcome those hurdles for in most cases now, but early on that was a great challenge, trying to connect loved ones with their family members. That was the greatest challenge to overcome.
Sure. Azad, I know that the Baha'i community has been affected, as have all communities throughout the Commonwealth. I guess the question is, what are you seeing now? Are you still seeing any kind of serious resistance within that faith community to taking the kind of precautions that we've been discussing here?
Thank you. Well, I think one thing that helped us a little bit was this, that on the 9th day of March, there is no clergy in the Baha'i faith, but there's a council body of 9 that is elected annually, and all the affairs of the community is going through that. Well, the meeting was called, and it was on March 9th. And after we saw what's going on around us and all the things that we heard and chaotic time that we were dealing with the different kinds of information, it was decided to be on level with the members of the community and give a guidance. So one thing that Assembly did was quote from a holy book that revealed by Baha'u'llah, saying that at a time of illness, consult with the competent doctor and follow the remedy from it. And then also to consult with more than one scientific organization or entity, and then make a decision. So whatever we do, it will be based on understanding, not just hyper. So that letter went to everyone. And then also with the guidance that from now on, we will have all of our meeting on Zoom. No one in person for the time being. And although we were all new at it, and some of our friends, they knew how to handle that, they all pitched in. And we said that nobody should go anywhere really with that mask. So there was a shortage of masks, and some of the ladies, they knew how to sew. They made us those masks, and then we were able to distribute it to the nurses because they needed to have more. But anyway, this is how it has been. But when the vaccine came, again, we were all was guided, to take the vaccination as soon as possible. And truly, we don't know exactly how many of the members were vaccinated because we didn't ask. But we have a feeling that good majority did. But still, we cannot be sure. So everything continues to be on Zoom and distancing. And every month that we have a gathering, we talk about this. And some people, they ask, how come? Why? And we say, well, this is why. That we are still not 100% vaccinated, and we have a range of age group in our community that we have to be concerned with all. And then we quote the, if you want to call it Baha'i golden rule, it says, blessed is the one who prefers his neighbor over himself. So the explanation is this, that not only we should be worried about myself, but also worry about the next door person too. Because I may be very immune to everything, but what about the next person? So out of common good, we have to care for each other and be able to exist together. And even now, still we are on Zoom, few people ask questions, we answer. And so we review that every month and then we go with that.
That really goes to the crux of the whole thing right there. So, am I going to be concerned about other people, or am I just going to be concerned with my own interests? Really right there. I mean, here's a question for everybody here. You just heard Azad say that they are still doing their services via online. Is anybody still doing that totally online, not meeting in person? Is anybody, anybody's congregation doing that? No.
No.
So everybody is back to their house of worship to some extent, at least.
Yes.
All right, all right. Here's another question for the group at large. What efforts did you make that during this COVID time that you felt were really, really successful, or conversely, that you thought this was an utter failure? What we tried to do simply didn't work. Any strategies that you think going forward people might want to follow because it worked great, you know, in your situation? Anybody have any views?
Actually, I was I would like to add one more few points here that for the Hindu community, we had made a COVID network team we had made, and I was part of that medical team, and one more doctor was there. So we were trying to collect all the data from the CDC's, WHO, and we were actually trying to put that on Zoom, and also we had a website for that. So people, of course, they were getting all the news from the TV channels. I don't say that. So, but still, to as an extra point like that, I was part of that team, and I think that message really did help to some extent, I feel. And also, I was part of the COVID-19 Health Network by David Saunders, if I think Dr. Johnson will know. So I was part of that team. Of course, the team had about 200, 100 to 150 people. So I was part of that. So trying to get some important messages from there and then spreading it to our community. I think it helped to some extent by interacting with the devotees. And I think that can help in future also if something else comes up. And of course, the temple, we were trying to use to follow the CDC guidelines as much as possible. And we did not really have resistance among the people. So
I suppose every one of the faith communities that we have represented here tonight, in those communities, someone has medical training. You may have a doctor, you may have nurses, etc. Did you enlist in any way the help of the medical professionals in your congregations to help you spread the word, or to make an initiative much more palatable for some of the people who may have been a bit reluctant?
One thing that helped us, we had a couple of very good doctors. They also took a part in conversation. I remember just a week or so ago, we had our monthly meeting, and we even mentioned that even if you get a mild case of the COVID, you have other disorders, from brain to loss of the sense of the smell, and maybe other things. I heard today that one of our friends had a kidney problem because of that. So we're going to have more and more of these things. Even though it was mild, it was not one of those dangerous attacks. So we talked about that, and I think that also made people to become mindful of it, that we are not out of the woods yet.
I think Reverend Wilford had mentioned that he had a kidney issue because of this. Reverend, was that something that you think your own personal experience helped get the message out to people that they needed to take these precautions?
Yes, I do. The day after, let me see, I spent almost 3 months in the hospital. and 2 weeks in rehab. And my first Sunday back, we were still wrestling. Many of the members were wrestling whether or not to take the shots. The day after, actually the same day I was released from rehab, I got my first vaccination. And then several days after, I guess whatever the time period was, I got my second. By that time, we were back into our building. My first Sunday preaching before the congregation, I revealed everything. I said, showed them the LVAD. I shared with them that that I had my first vaccination and my second, and waiting for my third booster shot. And several people the following Sunday who had refused to get vaccinated came to me prior to the beginning of the service and informed me then that they had received their first vaccination. And so Nicole can really give you a little bit more input. We had a team together. However, there was a lot of hesitancy, a lot of false information that was out there, people not knowing what was true, what was false, a lot of historical issues that African American people have wrestled with, 100 years ago, and so I had to clarify all of those issues, remove those fears, as well as get all of the information for myself, bring my own self up to date on the info. So
I want to ask Nicole about that, but let me just say this first, Reverend. I know that spiritual leaders are supposed to be standard bearers, but I don't think you ever thought that you were going to have to be that kind of example. But bless you.
Not at all.
Well, Nicole, you are in the Bethlehem Baptist Church there in York, and you just heard your pastor talking about some of the resistance there, some of the difficulties there, some of the misinformation that had to be dealt with. Talk to us about that.
I think a lot of the misinformation comes from social media, of course, especially the time that we're living in. Get a lot of our information from social media, whether it be Facebook or any other type of news outlet. And there was a lot of fear circulating about what this vaccine could do to your body, because it was kind of in the beginning, people were assuming that it was rushed to get the first rounds out. And so they were scared about the effects and they wanted to wait. They say, okay, well, you tried first. We'll see how it affects you. And then I might think about getting vaccinated. So a lot of the fear and that stigma was up in the air, I think, just in general. And our congregation was not excluded from that. Our reverend, our pastor, going through his experience personally, I'm sure swayed a lot of people to say that this is a necessity. Another one of our members, when the COVID first started, actually died from COVID, and that kind of hit people very hard, a member of our congregation. So I'm sure that also sparked people to say, okay, this is something that we really need to consider. But trying to outweigh the misinformation kind of, I think, really got people hesitant, is all the misinformation that was out there. And I think that's my opinion. I have a lot of questions here from the congregation, people outside of the community. So when we get to that section of this webinar, I definitely will
we're
share
at
those
that
questions.
section right now. If you've got questions that you want to ask any of these persons here or to the world at large, go ahead. What are some of the questions on your mind?
Well, we'll start with our first question, which is, are the side effects of the vaccine severe enough to lead to work loss?
Well, I guess we're going to ask Dr. Johnson if she would take that.
Sure, absolutely. So they can, certainly a lot of people get a sore arm from the vaccine. Some people get a fever, they feel achy. Some people feel fatigued. Some people just, when I got my first shot, I couldn't even tell that I had it. But a colleague of mine was in bed for the day. So you just never know how your immune system is going to respond. And so some people really can be sick enough to need to be off for a couple of days. Again, those are transient, they go away, don't leave a lasting effect. But we really have to be upfront and honest with people to say that, yes, it can happen, but it's not something to deter you from getting vaccinated.
That's as opposed to missing work because you're dead, right?
Yes, sure.
And I just wanted to add, Nicole, every time I got my shot, I had to go to bed within 12 hours. I was just out. But I knew that that meant for me, it could be far worse. I would be in the hospital for several weeks, or as the pastor did, for several months. So.
Yeah,
Cole,
I
do
had
you have
experience
any other?
I had experience with so many. For myself, of course, as Joyce said, it's the same thing. But even I know some of my friends, physicians, they were sick out for a week. It was like a COVID, but still too, they never gave up. They took first, second, and booster doses. And of course, booster dose was definitely very hard for everyone. I think many people became sick with booster than the first and the second dose. I think Dr. Johnson will agree with that. So,
I didn't get even sore arm, but my wife did. And I know some other people did too. But again, that happens even with the flu shot. And then some people, they said, well, after I got the vaccine, I still got it, but it was a mild one. You can imagine it would have been a more severe if you didn't have any vaccine, have a defense against it. So I think if you look at it in the right frame of mind and with a good attitude, we can see that it was really beneficial. And all those things that they say that you're going to die from it and all in between is not really true. And again, maybe one person in a million may die. You never know. But it's not that drastic, Even any loss is drastic. But in comparison, that almost over 900,000 people in this country died, one is a blessing that was not more than two. Maybe they sacrificed for us, to become better known and understand the vaccine better.
Well, thank you, Bezan. Thank you for that, putting that in context. Bo, do you have any other questions for the panel?
Yes, I do.
Oh.
So I think this is a conversation that has come up among my friends as well. If you already were contracted COVID, maybe once or even multiple times, why do you still need to be vaccinated? Like, what is the difference between already having COVID and then getting that vaccination? I guess they're assuming if you have COVID, you should automatically have the antibodies in your system, so there's no need for the vaccine. So what is the difference between having it and versus getting the vaccine?
Sure. So I think I assume that question's for me. I think a lot of, COVID has been so new for us, and we're continuing to learn more every day. And I think that in the past, we really thought of someone getting an illness, being immune, and then you're good for life. And what we really have seen with COVID is that's not true. We know people who have had COVID more than once. They've gotten COVID and they've gotten COVID again. We also have seen some people who have gotten COVID a second time and still been sick with COVID. So although we know that once you've recovered from an infection, you do have antibodies and you do have some immunity, it's extremely variable. And we don't know what that's going to be like. We don't have right now a blood test that's going to tell us for sure how much protection you have. We can check your antibodies, but again, we don't have a standard that says you've recovered, you have an antibody test, your level is X, so you're good to go. So we don't have that. And we know that if you get a vaccine after you've recovered, you've boosted your immunity and you can be better protected. So that's what we recommend. A lot of this is just weighing the risks and the benefits. And so, we don't know what the risk is to you. You know that the vast majority of people who get COVID don't die, but then we can't tell who's going to die, right? I mean, Our first patient that had COVID in our hospital was in her 90s. And she was sick for a little while, went home and did fine. We had someone come into the emergency department less than 50 and didn't make it out of there. And didn't have underlying conditions that we knew of. So we just don't know. You don't want to take the risk. And we know that the vaccines are safe and effective. And so that's why we recommend them.
Can
Is
I
it
ask
fair
a
to-
follow-up question on that?
Yes.
I mean, would you say this is somewhat analogous to the flu? I mean, you have different strains and you have to have different flu shots every year. I know it's not exactly the same thing, but
Well, we've been seeing that, right? I mean, I think that's I think we had the unreal expectation that if we got vaccinated, we couldn't get infected at all. And that's just not been true. But look at Omicron. I mean, people who have been vaccinated and boosted still got Omicron. They didn't get that sick, but they still got an infection because the virus, as long as it keeps multiplying, it keeps mutating. And you know, we still can get other variants that are different, that our bodies don't fully recognize.
Here's a question for Ron, for Paul, for Aaron, for Sandy, for Dan. Are these the kind of questions that your parishioners have asked over the last couple of years? Is this the kind of education that you have sought to give to people? The people, Dan, that you work with, for instance, I'm sure some of the people on staff have had these kinds of questions. Are these the kind of information that you are still giving to people?
Yeah, if I can go, in most of my churches, especially churches that are in the rural areas, where they don't have much information or they rely on information that might be fake or might not be really correct, they go with the idea that some of them were telling me, well, we had the COVID already and we're well, so why do we have to be vaccinated? I'm like, well, you need a vaccination, not just for yourself, but for your neighbor. I mean, you don't know who has it or who doesn't have it. And for the fact that if you are vaccinated, at least that prevents or protects you from maybe getting it again or even dying. I lost one of my pastors in this, and he was a pastor that wasn't vaccinated. He wasn't wearing a mask. Even though we were encouraging them to do it. So even at his death, people were still not wearing masks. So it was just a form of education that we are giving. We work closely with the CDC and the Pennsylvania Health Department. We got information from them and we share that information with our churches and our pastors. In fact, at some point, we had to encourage them to log on and the pastors to log on during worship services to really give education, more education about vaccination. But that's what was happening. And people were just saying, well, why do I need it? I mean, I already have COVID. I'm like, yeah, maybe if you had it, it doesn't mean you will have it one time. You may have it again. And you have to protect not only yourself, but other people as well.
Yeah, there was,
Go ahead, Aaron, go ahead.
no, I was going to say there was a, and not just with our parishioners, but even amongst our faith leaders.
That's exactly
I
what
know
was-
during the pandemic, because of the refusal of some faith leaders who were intent on not getting vaccinated, I lost about 30 colleagues across the nation, pastors and preachers that I knew, and you know, many of them refused to get vaccinated. Some of them did not necessarily refuse, but were not vaccinated, attended funerals and different services, venues, and came down with COVID. And because of the fact that they were not vaccinated, passed away.
Ron, have you seen that in the rabbinate, you know, whether in your circles or perhaps in Orthodox circles or whatever? Is that been an issue among the clergy at all?
You know, I think one of my takeaways is that, you know, you look around the screen, we're all human, you know, and among each of our, among each of our groups, we have people of different points of view. And one of the things that concerns me is, I guess I'll call it magical thinking. I think that, there are people that just have these notions that for one reason or another, they're not going to get it. And yet the science and our experience shows that happens. Just a few months ago, we lost a member of the congregation, a very dear man who was, by his own admission, very stubborn. And he refused to get vaccinated, and he died of COVID. And his widow, shortly after his death, did get vaccinated. And it's just a shame. It's a tragedy that, that people are kind of learning too late. And so I think we clergy are in this position where we have to simultaneously, as I said before, kind of hold on to, respecting everyone's opinion and seeing each other as fully human, and not denigrating anybody because they have different points of view. And on the other hand, I'm leaving this meeting just really feeling heartened that, I'm not alone, and none of us is alone. We have people like Dr. Johnson working, and Dr. Perk, working on the medical side, and we have clergy, and Joyce, we've got you bringing everybody together. And Nicole, thank you for your good questions from your congregation, because the questions your congregants are asking are questions that some of the folks I serve are asking. So I think if we can share our experiences, like Reverend Wilford was sharing, this isn't something made up. Nobody's getting any joy out of all of the sorrow and suffering. And if we can just tell each other's stories and bear witness, hopefully we can persuade people to do the right thing for themselves and for each other. Forgive me, this may sound out of context, but it feels relevant. When I was in Pittsburgh, Pennsylvania, in Squirrel Hill, a few days after that terrible shooting in October of 2018, there were these signs of support in all the windows. Even non-kosher restaurants, laundromats, dry cleaners, and the sign that really struck me deeply seems relevant here. It said, "Love your neighbor, no exceptions." And I just look around this screen and I see every one of us as being neighbors to each other, no exceptions. And I just pray that we should be able to share our experiences with each other and help persuade people to do the right thing and continue to be careful. I apologize while I'm speaking. I'll just sign off. I actually have to go run a service. We Jews pray each evening, and our service is at 7:15. And although I'm typically late, I'm the one with the key tonight, so I got to open the door. And Dr. Johnson, we will be masked and we'll be maintaining social distance. So I hope we'll be safe.
Thank you.
Thank you.
Thank you for joining us. Thank you so
That's
much.
one of the,
Pastor Goodman, I'm sorry.
Yes, sir.
I was just gonna say, I think
No.
that's one of the big messages. We're talking about masking still. And, and I know that a lot of congregations have now gone mask optional, but to, encourage people who still feel like they really want to wear their masks and need to wear their masks, don't stigmatize people who feel like they really need to continue doing that. There's a
Right.
reason for it.
There you go. Good word.
Yeah,
Good word.
I was going to say I'm appreciative and grateful for this gathering, to be invited. I appreciate Sister Gilbert for bringing this to my attention and including me in this, because it does not again happen just with our congregants. It happens with our faith leaders. When I was sharing with some of our faith leaders the various moves that we were making in regards to our worship experiences, I had a lot of them, unfortunately, question my faith, and whether or not I believed in God, or trusted the God that I serve. And I tried to get them to understand that God gives us common sense. And it's up to us whether or not we choose to use it. I had one person say, well, this was the Lord's doing. And I didn't argue, but I debated that everything that happens is, even though God is aware of everything, but not everything is the Lord's doing. He gives all of us a choice. And it's up to us to use those choices to benefit us and to benefit the persons that we serve.
you're so right. My wife and I, we are still not mingling with anybody. We still have our mask. Even when we go shopping, we go first thing in the morning before the store become crowded and wear our mask. And we see that a lot of people do not. So, but we cannot control that. We can control ourselves. And then the only place we go for a walk daily. And so we won't get cabin fever, as they call it. So I think God has given us all the talents to deal with whatever comes to our way. It is up to us to use that into our benefit.
Mm,
That's
mm.
all.
I'm reminded of something after Reverend Wilford. I'm reminded of something somebody said. I fully trust in the Lord, but I still look both ways when I cross the street. Nicole, do you still have any? You have any other questions for the panelists here?
I do have more questions.
Fire away.
Okay, let me see. Some of these were already covered.
Well, I'm glad to hear that.
So do the vaccines alter your DNA?
Oh, wow.
It's a very quick no. And I think that yeah, again, people just fall prey to the misinformation, and it really is sad because some vulnerable people put themselves at risk because they're listening to this. And it also amazes me at how, some people will not take the vaccine because it, was under the emergency use authorization and not fully FDA approved. And then they take other treatments that are clearly harmful and have not been vetted and tested and safe instead of taking the vaccine. As I heard here, it's just disheartening. It's just really disheartening when we lose someone that could have been prevented. And I'm sure it's heart-wrenching for those families as well. It's just really heartbreaking.
Mm-hmm.
Yeah, even I think they were talking about infertility also. There was such misnomer going on. So I think for that reason, I think one of Joyce Davis knows about Dr. Nirmal Joshi and Dr. Renu Joshi very well. They had been highly instrumental in coordinating all those webinars for our Hindu community, and it really helped. And also I would like to mention Deep Gupta, who is the chairman of Asian Indian American of Central Pennsylvania. So the leaders really, they try to really give the positive aspect, as we are having so many misnomers attached to the vaccines. Mm-hmm. And one death occurs out of what is the incidence is so low, which can happen with any vaccine, not just this vaccine.
Sure.
So, so this is what we have to teach and make people understand in the community. This is come with the facts and figures and explain to them, this is this, this is this. It's not just with COVID-19 vaccine. This is where from hundreds of years we have vaccines which have come up, and then the incidence of all the adverse effects is very less compared to the effectiveness of the vaccine. So just want to add.
And I think you're right. We also have such experience with these vaccines that we've never had before. The number of people who have been vaccinated, we have this incredible safety profile because we could see how many people have gotten these vaccines and that they're safe and effective. But then also, as you mentioned, I'm an OBGYN physician, so really sad to see that, we know that during pregnancy, if you get COVID, you're so much sicker, you're so much more likely to be in the ICU. We've got studies now that show that you have more miscarriages and stillbirths. And then we've seen that with vaccines that you don't have that. And so, the data is there now, but people still have that hesitancy. I think people think if I don't do something, it's going to be less risk than if I do something, but it's just not true with COVID.
I have a live example, last comment just I want to make about the vaccine and the pregnancy. My daughter was pregnant, and that was in June or July of 2020, when there was no literature around about this vaccine is good, bad, whatever. But just because I am very liberal with the vaccines. I take all vaccines as of now. So I just told her, you are going to take vaccine. And she took it. And by God's grace, and she took both the doses and the booster, and everything is good by God's grace. So this is a live example I'm telling, because there were no studies outside. But I knew these vaccines are good for the mother and the child. So, and finally, the literature came up that they are safe and all that. So
I have to share a personal story because my sister-in-law she and my brother had their first child. She was 49 years old. She made the decision to get vaccinated in the middle of her pregnancy and gave birth to an absolutely beautiful, perfect child. And she does not regret that. She was ready to go do that immediately.
Congratulations.
And I was
Congratulations.
privileged to have the Secretary of Health for Pennsylvania on one of the shows, and she is pregnant. I think she said in her 6th week she got the vaccine because she wanted to protect her baby boy that was growing inside of her. So, yeah.
Before we go back to Nicole, I just want to ask Reverend Dan very briefly. We've been talking about the reticence that certain people, faith leaders, have had about getting vaccinated and taking these precautions. You're in the healthcare industry, to so to speak, because people there are caring for any number of persons often with medical conditions. Have you seen any of that kind of reluctance on the part of the staff to get vaccinated and to practice these precautions?
Not to practice precautions. The protocols are very clearly defined in any institution that I have ventured into over the last 2 years. But like the rest of our common population, our common humanity, there are different opinions. There are different perspectives, perhaps other different life challenges that people face at different ages. So I've encountered a variety of opinions. And healthcare workers reflect our common humanity here tonight, and what I think we see and hear among people throughout our country. There are some different opinions.
Very good, very good.
Dr.
Patience.
Jackson, you were
Patience is
1%
always
was so
required.
true. Oh, I'm sorry, go ahead. I was going to ask you, mention what Dr. Johnson said about the vaccine is so true. Several members of our community, after getting vaccine and all, they contracted COVID, but it was very mild. And you can imagine if they had not had any vaccine. So that's really the testimonies that we can share with people that, yeah, regardless of what they say about the vaccine, the truth is that it is working and has worked and will continue to work. I think even Pfizer now asked for getting permission for the second dose of the vaccine, the booster one I'm referring to. So we can be okay with even getting the second one.
Nicole, do you have any further questions? I'm sure you must.
Of course, of course. The question about how long the immunity how long are you protected after you get the vaccine? So is this going to be like a continuous every year you have to get, first vaccine, second vaccine, and the booster? Is this going to be a continuation throughout, your entire life?
So don't have a great answer for that. We're still figuring that out. This COVID virus was, the SARS-CoV-2 virus is new. And so, I think that we saw that we got more information as this pandemic went on. I think that things that we thought about earlier didn't bear true when we got more information. So I think we're just watching and seeing. We know that your immunity wanes some, but how much does it wane? And does it wane enough that you need to get another booster? So I think we just are getting more information. So right now we don't know. It's possible that we will need more in the future, but I think that right now what we've gotten is protecting us against severe illness and hospitalization, and that can't be understated. I think that some people also think Well, I don't have to worry about that, but if there are a lot of people in the hospital, then the hospitals are overwhelmed. And so if you break your leg or you have a heart attack and the hospital's full, you don't have COVID, but you still are affected by this huge number of COVID cases. So it does affect all of us. I think we also feel that, I just have to care about myself, but even in those actions that you take, it affects other people, even if you don't think that you're directly affecting them.
Dr. Johnson, if I could follow up on that, this is one of the issues that I'm still perplexed with and why I'm still like Behzad, very, very careful. The only way you're going to know when that vaccine is no longer effective is when someone who was fully boosted and all really gets sick or dies, right? So that's my concern, that I don't really know. Okay, so I know I'm over the 6 months now, but I don't know when is that actual point when I really am not protected anymore and just don't know it, right?
So we don't know that yet, but there are hundreds and probably thousands of scientists that are studying every single aspect of COVID. And so, every week, probably more frequently than that, we have more studies that come out that add to our body of knowledge. So I think at some point we're going to have some measure of what our actual immunity is and what the recommendations will be. But we just don't have that information yet. But I believe that we're going to get it.
Add one
Another
point
thing
in
that
that.
we can help people to
Can I-
understand more is this, that we had vaccine historically with us from the time of Civil War all the way to now. Anytime we send our children to school, they have barrage of the vaccines, every year or every 2 years. And I think polio was the one that was so deadly. We conquered that. So I don't know what is going on with this COVID-19 that suddenly we are becoming, it become like I don't know what. It really blows my mind that it has worked in all other illnesses and diseases. Why this one has become so politicalized?
I can add one point here. Okay, this is the issue with the COVID vaccine is something like flu. Every year, that there are different strains which have mutated and variants are there. And then we try to pool those variants from the last year, and then we give the vaccine this year, okay? So similar situation is also there with this COVID virus. Now we know that there are so many variants are coming in now. And those variants, the vaccine which has been prepared already may not be having this variant. So even if you give this vaccine, it may not be effective 100% with that new variant, which are coming now, as we know. Omicron 2 is coming, BA2 variant, Delta Cron, which is a combination of Delta and Omicron. They're all coming, they're all there somewhere. So they may come. So at that situation, we don't know how much this present vaccine is going to be effective. So this is all about the variation, genetic variations, which is happening in these vaccines. So the polio and all that, we know there are 1, 2, 3 types of polio viruses. We know assigned viruses. Okay, measles is one virus. So I think Dr. Johnson would also agree with this because of these variations, genetic variation, which is having in the vaccines. So we are really don't know how effective it's going to be next time. So.
But that's why I'm saying we should keep masking. We should keep social distancing. We should keep protecting ourselves, right?
I have a question for Dr. Johnson. We hear so much, we're beginning to hear quite a bit about COVID, anti-COVID pills, something from Merck, something from Pfizer, etc. Tell us, for those of us who don't really like to be pricked by a shot, what's the status of the pills and what good are they?
Okay, well, great question. So first of all, the pill is not an alternative to the vaccine. So that, the pills can give you some protection if you get COVID, but they don't work nearly as well as the vaccine. And so that you don't want to just sit around and wait to get COVID and then take the pill, get the vaccine. But for people who are at high risk, because again, people who are at high risk still can get sick with COVID. So people who are high risk can get these pills to treat COVID. just like you would do when you have the flu and you take the antivirals like the Tamiflu or something like that. So
Mhm.
it has to be taken really, really early, as soon as you start your symptoms, and in many cases before 5 days to take these pills, but they can significantly reduce your risk for hospitalization. And we're getting more and more of those available. Just about any doctor can prescribe it for you. And on our website, it tells you where you could get that prescription filled.
Dan had to leave us, and we are coming up very close to the end of our program. But I just wanted to give Nicole one more chance to see if she's got another question or two that she wants to throw out to the experts here. Nicole?
I'll add one more question. I just wanted to add some input. I know one of the panelists were saying, how come we're coming up with this, fight against the COVID-19? I know from just my experience with this generation being exposed to so much information. We have information, at the tip of our fingers. We just Google something and we have tons of information that we can consume on a daily basis. So I think that the anti-vaxxers, they have statistics, they have science too. So we're getting both sides of the story. And so that's why I think what leads a lot of people to saying, okay, well, I'm going to make my own choice based off of all this information that I'm taking in. So I think that's where a lot of the battle is. And so my last question, I know, again, this generation that we're living in, we think that if you consume the right vitamins, if you eat the right food, you can build up your immune system enough to fight off anything. And I want to know if there's any truth to that. Instead of getting the vaccine, could we boost our immune systems by taking, vitamin D, vitamin C, and combating it that way?
So I'm sure others will weigh in on this. I think that, we don't know of any combination of vitamins that are going to protect you against COVID, because right now, even in healthy people, we've seen healthy people die of COVID and we don't know why. So we still are gathering more information. Maybe at some point we'll find out there's something magical that would prevent it, but there's no science right now that shows us that there's something that can prevent you from getting COVID. And the other thing to remember with social media is that things that are outrageous and shocking get more views, and so that we amplify this misinformation and really false information because it's so appealing. And so that we just really fall into that trap. We just continue to consume this information that is wrong because of the way that it's presented. So that has been really distressing in my work and for many others, because it's really a lot more difficult to present the truth than to make up something that's just really outrageous and just get that followed.
Well, thank you for that, Dr. Johnson. Thank you, Nicole, for that question. As I was listening to the response, one of the things that I was hearing is that we are still advised to eat our broccoli. I want to thank you. Thank you for that question. It's not time.
And if I can add to that,
Oh, sure. Go ahead.
to Dr. Johnson's answer, when you eat healthy and live a healthy life, like exercising, that will reduce your risk of having underlying factors that may cause death or easier infections or easier attack from COVID-19. So if somebody who is healthy and somebody who has underlying factors, if they have COVID, we know where that will lead to. Those who are healthier may withstand the trend of COVID, but those who already have underlying factors may be affected easily. So we just encourage everyone, health is wealth. So you live a healthy life, you can really you can stand a lot of things that come your way. So Nicole, that's my answer to you.
Well, thank you, Paul. I thought that DR in your name stood for PhD, but maybe it's MD or something. Thank you very much for that. Well, again, I think we are now pretty much at the end of our program. Before I turn it back though to Joyce, let me just say this. The information that we have received from the medical professionals tonight, the testimonies that we have heard, and particularly that of Reverend Wilford there, I think this has just been incredibly valuable information for everybody who is listening to the program tonight. I appreciate each and every one of you. Blessings to you. Thank you so much.
Thank you.
Well, I think Russell Goodman outdid Joyce Davis as a moderator. Well, that is really something. But let me say this. I want to thank everyone for participating. And I also want to give a very sincere thanks to Jerisha Gilbert and to Pastor and Nicole at the Bethlehem Baptist Church of York. You took the initiative. You reached out. You said, can someone help us get information to our community? And again, my heart is so touched that Dr. Johnson, every time we reach out, she responds because she wants to help our community. So thank you all for being part of this. And I give this invitation, anyone who's watching this, if you want to get a vaccine, if you can't get there, if you need an Uber driver to pick you up, we will pay for that. Contact us at wachharrisburg@gmail.com, wachharrisburg@gmail.com. We will help you find a vaccination clinic, and until they run out, we will give you a gift card for $10. So please get vaccinated. Contact us. We'll do all we can to save your life. With that, thank you all. Enjoy the rest of your evening, and I'll be calling again soon. Bye-bye.
Thank you.
Thank you all.
Bye-bye.
This was
Thank you.
fantastic.
Good
Thank you.
evening.